caring for our patients, and I'm going to segue from what we previously talked about, the different disease states and chronic disease management, to talk a little bit about, for example, diabetes, which we're seeing a lot of. It's at much higher levels than it used to be. People are living longer, so they get diabetes. One handout that I have that I'm going to leave that I bring up a lot, there are 40 different factors that can affect blood sugar. A lot of times people think, oh, it's just the food, it's just medicine. There's actually so many factors that can impact blood sugar levels that people don't realize. This is a very interesting handout that I'll leave here so you can review it to understand that when your patients are saying, my blood sugar is so hard to control, there's so many things behind the curtain that could impact it. It could be their medication that they're forgetting to take, that they're taking double doses of, that, again, like I mentioned, their kidneys may be changing, that their eating may be off, they may have some sort of infection or dehydration, or they're not moving as much as they used to. Stress problems, sleep problems are also part of diabetes impacts. So again, 2 different factors are pretty overwhelming to think about, but I think this is a great resource. Additionally, many people with diabetes go out and buy special diabetic foods. And I'll leave a few boxes of these so you can taste them because I get these samples sent to me all the time. So this is an example of diabetes-related food, a low-sugar chocolate chip cookie. Now, they're not going to taste exactly like, the traditional chocolate chip cookies that we think of all the time. They're not bad, but what I want to also bring up is that, first of all, there can be some good parts about it. It's made with different sorts of sweeteners, so it doesn't spike your blood sugar as much as, typical cookies do. But on the other hand, a lot of diabetes related food products can be made with certain sweeteners. That can actually have a laxative effect. Anything that ends in an OL, xylitol, sorbitol, mannitol, just like medications can cause diarrhea, these can too if eaten in large quantities. And just because they're low sugar does not mean they're low calories. So some people say, oh, I'm just going to eat all the diabetic cookies I want because it's really not going to make a difference. Well, it can for those reasons I just mentioned. So I'll be leaving some of these here. You can decide whether you like them or not, and at least you'll know what they taste like, right? Because that's important too. So to go on, we're going to talk a little bit about this one handout I happened to capture on one of my nutrition support websites. I think this is a brilliant handout because it shows so clearly where nutrition starts in the mouth. And even people, as we get older, oftentimes, even if they're not eating by mouth, if they're supported by tube feeding, mouth care is critically important because of all the infection and bacteria that can infiltrate the gums and actually has a direct line to the rest of the body. As you can see here, the heart, the GI tract, but we are seeing more and more of the fact that high amount of bacteria in the mouth is a leading cause of pneumonia. We have started to really look at that in terms of the high risk of pneumonia in the hospital setting. You think sometimes it's because of aspiration or other reasons, but this bacteria can directly affect the lungs. So good oral hygiene is a very, very big deal for a number of reasons. And this is not just for seniors, it's for all ages. It even shows how it may adversely affect pregnancy outcomes. So when I do a lot of classes for seniors especially, I review the importance of dental hygiene. And again, even gum infections that are pretty common in themselves are an inflammatory state, and they can increase blood sugar levels. And then high blood sugar levels feed bacteria. So again, it's a bi-directional issue. Okay? Any questions about this?
So, yeah, good oral hygiene, like the full brush twice a day?
Yeah.
Or is there like times where you're going like, no, you need to be brushing more, or?
Yeah, I would defer to the dental hygienist. Your dentist, dental hygienist, I always say listen to your dental hygienist because they're the ones who really get in there and see the things and treat and clean. And of course, the dentist is going to fix a lot of other things at a higher level of care. But dental hygienists have a lot of great tips, especially if somebody has a lot of missing teeth or issues with their gums, the types of toothbrushes to use, the types of flossing methods if they don't have a lot of good dexterity, the types of mouthwashes to use that can be extra helpful. There's a lot of issues that start in the mouth that can impact the whole rest of the body. So what I see a lot, I look at dental care no matter who I'm working with, because again, if that affects swallowing and chewing, and then their teeth are not doing well, of course their diet's going to be impacted. Okay? So dental care is going to impact every single part of the body. What I want to also mention too is that with missing teeth or loose teeth or dentures, when there's malnutrition and weight loss, of course, that impacts the muscle around the mouth, and then the dentures start not to fit anymore. You've probably seen that, then they don't wear their dentures. And so again, there's a bidirectional relationship between malnutrition, loss of muscle around the jaw and the mouth, and just the fact that the dentures don't fit, and then they're even more likely to not be able to chew thoroughly or swallow appropriately. That sets them up for issues with swallowing and whole body malnutrition. Okay? So with that, we'll take a little break and we'll move on in the next segment to swallowing issues.